started. So good evening, everyone. My name is Jacqueline Martel, and I'm humbly serve as the director, the New York Director of Advocacy for Achievement First Public Charter Schools. It's an honor to be here this evening amongst wonderful parents, advocates, community leaders, and our esteemed speakers. Before we start programming, I just want to give a moment for those who need translation to access it. And our Spanish translator, if you could just translate this portion, please. If you would like Spanish translation, please press the globe button on your screen. Nancy, do you think you can translate that, please?
Si necesitas ayuda con español o inglés, por favor, hay un botón abajo que tú puedes ponchar. Si no lo ves, pon la mano.
And if you have any questions, just throw it in the chat function and our chat managers will assist you.
Si tienes preguntas, nada más tienes que poner tus cuestiones en el chat box. Si tú ves para abajo, dice chat, C-J-A-T. Si tú ponchas eso, tú puedes comunicar. Si tienes problema.
Gracias. Tonight, we are here to discuss the COVID-19 vaccination, including the science behind it, the vaccination rollout, access, and the critical issue of equity during the vaccination push throughout New York City and New York State, the impact of health inequity and healthcare disparities on our marginalized communities through the COVID-19 outbreak, and how we can work together to start to change this and shift these conversations. Before we start, I want to get a feel of the room. So we're going to just launch one quick poll question. Have you gotten the vaccine, and do you plan to get the vaccine? Awesome. We're doing this to get a feel of who's in the room and to get information on your thoughts on around the vaccine. Awesome. So we see those trickling in. Majority plans on getting the vaccine. Awesome. All right. So it's good to know that. And you can see for the most part, the majority plans on getting the vaccine. So this conversation is very timely. For the first part of this webinar, we're going to hear from our elected leaders on vaccine access. And then for the second part of programming, we're going to be hearing from our health experts and our equity experts. The Q&A chat function will be available during this time. So please place any questions that you have in the queue, and our amazing advocacy team will be forwarding them to me accordingly, and I'll trickle them through. So we are joined today by our distinguished guests, New York State Senator Julia Salazar of the 18th District, who actually has 9 Achievement First schools in her district, and Assemblymember Walker of the 55th District, who is a friend of, and who has participated in many of these Achievement First forums. Thank you so much for being here. Brooklyn is very much well represented here today. For all of my AF team members and family, just throw in the chat which school you represent, which Brooklyn neighborhood you represent. If you're not from Brooklyn, or if you don't go to an AF school, which school you represent or which neighborhood you represent. I want to also get a feel of the room. I see people coming in, and we already are getting questions. So we want to thank these amazing trailblazing leaders for their dedication to the districts that they serve, and the work that they're doing in making sure that our voices are heard in Albany and beyond. So we have some amazing women in this room tonight. Thank you so much for being here. Senator Salazar, I'm going to turn it over to you to address the audience this evening.
Good evening, everyone. It is really a pleasure to be here virtually with all of you. I look forward to the day when our city and state have recovered and we can actually be together safely in person, but it really is a joy to be here with you. And thank you to the faculty and staff who coordinated and organized this for us this evening. I am really honored to get to represent the 18th district. We call it the Great-teenth district here in Brooklyn, including 7 of Achievement First schools. So I'll start off by saying that the policy in terms of COVID-19 testing and vaccination is largely directed by the executive, by the governor, but those of us in the legislature, Assemblymember Walker and myself in the state Senate, we have an important role to play in advocating for you all and advocating for greater access to testing in areas that have been most impacted, which includes, virtually all of our districts in Brooklyn, and the district that I represent and that Assemblymember Walker represents. We have some overlap, particularly in Brownsville, and I think in East New York as well. So we play an important role in interceding between the policy that comes from the governor and what is actually happening on the ground, and advocating for our communities when we see inequity in how testing is being conducted, in access to the vaccine, and of course, in the disproportionate impact that the pandemic has had on our communities, both in terms of public health outcomes and the economic impact. But to specifically focus on the vaccine this evening, I want to provide some basic information first and foremost. There is a website that is just Vaccine Finder. I'll put it in the chat, but it's vaccinefinder.nyc.gov, where anyone who is eligible or thinks you may be eligible to receive the COVID-19 vaccine can find a vaccination site, as well as, of course, you can go there and look on behalf of, say, a parent or someone who you believe is eligible to receive the vaccine, so that you can make an appointment for them to receive it. It is, and I realize that there are clinicians on the call who will probably speak more to the science of the vaccine as opposed to the policy that I'm speaking about, but I think it's important basic information for folks to know that it is a series of 2 shots that are supposed to be administered. The second one should be administered a few weeks after the first dose, although it can be administered beyond that. So for anyone who may have received the first dose of the vaccine or has an appointment to get the first dose, it's okay if there is a more extended period of time between the first and second dose if absolutely necessary. But the goal should be in New York that everyone who receives the first dose of the vaccine can immediately make an appointment to receive the second dose in a timely way, because only after having both doses of the vaccine can you really be quite confident that you're protected from the spread of the virus. So I also want to talk a little bit about what steps have been taken to ensure equity in access to the vaccine and the impact. So the city established a COVID-19 equity task force, and ambassadors, community leaders, clinicians, people who are geographically based. And additionally, we are really demanding that there are vaccination sites in our districts. For example, there are a few in the 18th district. People can make appointments to receive the vaccine at Woodhull Medical Center, at Wyckoff Hospital, also at a federally qualified health center, Broadway Family Health Center, and I believe there are actually additional sites in our district, but I will put in the chat again the link to the Vaccine Finder, so that regardless of where you are, and certainly if you live outside of our Senate district, that you're able to find a site and make an appointment if you're eligible. Currently, eligibility is limited. And we're really pushing to make sure that eligibility is expanded as quickly as possible in accordance with supply. I personally have been a little disappointed in the rollout. I think it's really urgent that we actually expand eligibility sooner than what is currently projected. We are in phase 1B now of the vaccine eligibility, the vaccine rollout. And it really is important that more people be eligible to receive the vaccine. I just want to pull this up really quick. I know that, right. So right now we are in phase 1B still. And that means that school district faculty, school staff, of course, are eligible to receive the vaccine, and we definitely encourage everyone to do that. Anyone who is eligible, I'll be putting that link in the chat as well, just for everyone's reference. But those are some of the basics right now. And I will stick around in case people have additional questions specifically related to the state's role and how we can help you in making sure that you have all the information you need, determining eligibility, making appointments, etc.
Thank you so much, Senator Salazar. That is very important information. And we also look forward to working in partnership with your office, any resources that you have. We saw Assemblymember Walker throwing them in the chat. She is doing the lovely work of our chat managers. She's used to these forums. Thank you so much for doing that, Assemblymember. But any resources also that are referenced during this call will be added to our resource advocacy hub. And Senator Salazar, thank you so much again for your leadership on the state level in terms of what you said. One, expanding access, and also just getting the information and having these critical conversations around the vaccine at large and the hesitance that lives due to the systemic inequities within our healthcare system. So thank you so much for your advocacy on that. Assemblymember Walker, I wanted to turn it over to you and allow you to have the floor to also speak to our guests this evening.
So good evening, everyone. Good evening, family. It's good to be back together again. And of course, a pleasant good evening to my colleague and partner, Senator Salazar. I was very grateful to be able to go behind her because I was like, what am I gonna say? And so with all of these different Zooms, it's like, you know, you're prepared for like 50 million different meetings and they're all happening at the same time. And so, and I see like, you know, so many folk who are on here who, of course, I am the president of their fan club. We got Yomika and Kel, and so this is great. So I feel I also saw Nancy, and so so I'll leave all the expertise to the experts, but I will say that of course there are a number of inequities with respect to how COVID-19 is being handled, period, whether it's the test and trace, whether it's the, you know, testing originally as we were going through the pandemic at its height last year. And of course, with respect to the vaccinations. You know, my mom, it's so funny, like we started out with vaccinating people who are over 65, 75. And so my mom is from South Carolina and she's like, I don't even fly. Like, what do you mean take a vaccination? And so, you know, trying to convince this group of folk who, you know, remember, you know, discrimination and racism in healthcare policy, like, you know, it was a thing. And or else, you know, all those folk who kind of grew up during TB, and as a kid, I'd be like, what is that thing on your arm? And they would like, you know, and so so trying to convince these folk to like get vaccinated was not an easy task. But my mom was vaccinated maybe about a week and a half ago. And she's doing great. And we have been, you know, really on the governor in terms of opening this up. So different people in all age cohorts can gain access to it. I haven't been vaccinated yet. And it's simply because, you know, they just haven't gotten to my number yet. And I'm patiently waiting, like, what do you mean they're running out of vaccines? What do you mean they didn't buy enough? What do you mean we won't have a second dose? And so a lot of this stuff is, you know, a lot of the same hysteria that folk may be going through. Just know that, you know, we're all in this together, and it's a living, breathing, moving set of circumstances. And so, of course, if, you know, there's some information that may come out today and then it changes tomorrow. And then people really quickly, and they go into, oh, they're just playing games. But you know what? They say the same, like at one point in time, you know, coffee was really bad, and then coffee's great, and then wine is really bad, and then wine is great. And then you don't drink, you know, don't have a glass of wine while you're pregnant. Oh, but one glass of wine a month while you're pregnant is amazing. And so, you know, a lot of this just sort of goes on sort of the ebb and flow and how we evolve and change as human beings, and as science does too. And so I would definitely say just pay attention to the science. For a vaccine to get to the point of a third stage has meant that it has gone through years and years of testing. They didn't just come up with a COVID-19 vaccination. Like, they've been studying this thing since SARS, which has been around for a very long time. And, you know, there may not necessarily be a better vaccine with respect to, should I go get the Pfizer or should I go get the Moderna? It's almost like, you know, which vitamin C is better? It's vitamin C, right? And so, and I think that becomes, I guess, some of it is a lot about the process and, you know, refrigeration, et cetera, et cetera. And then one of the things that I saw in terms of, I guess, I don't know if I can consider this a trick of the trade, or, you know, I could be dead ass wrong for saying this, but I don't think so, because I did see some guidance on it. But we are having a number of different vaccination opportunities. And what happens is, if, let's say, we're doing a vaccination at Brownsville houses, and folk may not necessarily live in Brownsville houses, or may not necessarily fit all of the requirements for eligibility. When they open the pack, I don't remember exactly how many vaccinations are included, so I'm not gonna go there. But I will say that when they open it, there's a certain amount of vaccinations that are in a pack, and they have to use all of those vaccinations by the end of the day. So at the conclusion of most of those vaccination events, if you show up, you know, a few minutes before they close out, that may be an opportunity for you to be vaccinated, because they just released some guidance. I don't know if you want to, I'll try to pull it up, but it's on the governor's website, where they'll open it up to other people who may not necessarily fit the bill. So if you want to get vaccinated and you may not, you know, meet the eligibility requirements for whatever those dynamics are. So I'll say that as another opportunity and option in order for folk who want to be vaccinated to be vaccinated. And so vaccinations, you know, don't save lives. People who get vaccinated do. And so if we're out here, you know, trying to save lives and trying to save each other, that's what we have to do. And I look forward to continuing, you know, working with you. I did put some information in there about how do you find a vaccine, how do you find where the locations are that they're giving them out. Of course, we're still encouraging people to get tested. People are still testing positive for COVID-19. And so at one point in time, people were rushing to get tested, and we're having a problem now where a lot of testing is sort of dropping off. We need you to go get tested. I get tested as often as I possibly can. I think at this point, they don't want to test me once a week anymore, but I know I have a 75-year-old mom at home who's now, you know, probably safer than me, but I had to do what I had to do in order to keep her safe. And then I have a 9-year-old as well, and want to make sure that everyone is cool. So it's always great to partner with you. Be educated, know what you're doing. go into these circumstances, you know, in full force, and make sure that you are the best credible messengers to the people on your block, to the older folk in your schools, who you're having Zoom church with, because we want to make sure that, you know, this doesn't leave us behind. So thank you.
Thank you so much, Assemblymember Walker. As always, dropping so many gems there. And to your point as well, it's about one, keeping ourselves informed and educated, and educating our circle of influence, whether that be members of your church or people that go to, you know, your schools, family members. It's important to continue this conversation. And to your point about also stopping the spread and testing, Nancy, who is on the call, will also, she's here from New York City Health and Hospitals. She'll be talking about some COVID testing program that the city has, that they've expanded recently. So we also will be addressing testing. So I want to thank you so much for being here, for always being in partnership with Achievement First and the New York Charter Schools Association. We look forward to continued partnership, and thank you for advocating for us, Senator Salazar and Assemblymember Walker, throughout the state and the city. In Brooklyn, we love you and we thank you.
Awesome. So Leslie Redwine was one of the first people who I ever met. And she was, you know, I guess she was an Achievement First pioneer into New York City. She was from out in Chicago. And so, you know, the relationship has existed for a very long time. And so anytime you need me, I'm here. But I'm going to have to run, but yes. God bless you, everyone. Stay safe, get tested, get vaccinated.
Yes, thank you so much.
And stay in your own areas. Like, you know, I don't want to be turning around and we got folk up here from Geneseo, like, you know, hey, can you show me where Bushwick Avenue is? No. Go back. There will be a test coming near you real soon.
I love that. There will be a test coming to you really soon. I love that. Thank you so much. Thank you again. So as we transition now to the second part of our conversation, where we'll be speaking with our health experts and our equity experts, I want to turn it over to my amazing partner in crime on these calls, the executive director of the New York Charter Schools Association. She is a pioneer, a leader. She just got off out of a hearing, an assembly hearing, advocating on behalf of the students and the teachers and school staff in New York. So I want to turn it over to Yomika.
All right, great. Thank you, Jackie. Welcome, everyone. I'm so glad that we have this forum today. I'm so appreciative of the legislators who came and spoke today and shared their wisdom and their words. And I'm very happy too that our health experts and esteemed folks are here to answer questions for the second part of this webinar today. And having said that, I will get started. I'm going to take a little bit of brief pause just to talk about the translation. We do have the Spanish translator on. We are going to pause to make sure that everyone hears the questions and the answers, the information in real time. You can also check the chat. The answers will be translated in the chat. But we're going to, so as I ask the questions and the folks as you answer them, we're going to take a pause between each one to allow the Spanish interpretation. We are going to be, of course, inclusive and equitable and share our space the way we should. All right, without further ado, I want to say thank you for joining us, and we are welcomed by Dr. Lekeyah Wilson of Rochester Regional Health, Dr. Jasmine Travers, and there's a lot of Ph.D. RN, AGPCNP-BC, CCRN, assistant professor at NYU. So we have the team here ready, willing, and able. We have Wilma Alvarado-Little, Associate Commissioner, Director of the New York State Office of Minority Health and Health Disparities at the New York State Department of Health. And we have Dr. Lina Finlan of St. Peter's Hospital here in Albany. And let me know if I missed anyone. I know I joined late, but I think I have the whole crew here. Again, ready, willing, and able, and highly qualified. Welcome all. I'm going to jump in. As I said, we're going to cover a topic with important information, potentially life-saving information, as we heard already from the folks who elected officials who opened up this event, as well as Jackie. And this outstanding panel of experts from across the state is here to share their knowledge and expertise. We're going to pause now so we can, for the translation.
I wonder if it's Spanish or sign language, what the translation is. You know? I wonder if there'll be anything about Long Island.
All right, we're having a little bit of technical difficulties. We'll jump to the first question and we'll allow the interpreters, Elda, to translate after this first question. And so I'll open it up with what I know, right? So first of all, what I know is what everyone knows, what you've heard already, that the vaccine is in limited supply. There's much more demand for the vaccine than there is supply right now. The state gets about 250, 300,000 vaccines a week, and those vaccines are distributed to the regions throughout the state. Nursing home residents and healthcare workers were the first to get the vaccine. The question here is, who's currently eligible for the vaccination? How do eligible individuals find out where to get vaccine? Now, I know that Senator Salazar covered a lot of that. I want to just allow the folks on the call from the healthcare institutions to be able to add any additional information or add any update for that. And we'll pause for the Spanish interpretation.
Buenas noches. ¿Quién es disponible de obtener esta vacuna? Y ¿cuándo es que uno la puede obtener? Si tiene que ser las personas que viven, que trabajan para médicos, enfermeros.
Okay. So I'll open it up to the panel. Dr. Wilson, Dr. Finlan, Ms. Alvarado-Little. Do you have anything to add on the vaccines and the eligibility and what people should know?
Well, thank you very much for the opportunity. I think a lot of the information had been covered by Senator Salazar. I would redirect to the DOH COVID-19 vaccine website and also the hotline. And I can put that in the chat box as well. And again, the one thing I do want to bring attention to is that the pre-screening tool is available in the top 6 languages for the state of New York. And those top 6 languages are identified by American Community Services 5-year data or the most recent US Census data results. So right now, we're going by the most recent 5-year ACS, American Community Survey data. And those languages are Bengali, Chinese, Haitian Creole, Korean, Russian, and Spanish. So if folks have the opportunity to go into the COVID-19 vaccination website, that information is there. And it's really important to look at the box on the registration tool to mark the language, because that's how we identify the language access services at the various points of distribution. So for example, at Javits, there's language access there as well.
Very good. All right, thank you very much. Before we move on to the next person who might want to answer, I want to ask the interpreter again to update us in Spanish, please.
Básicamente que los bengalíes y los haitianos y los criollos y los que hablan español se está promoviendo más en esa área, la de la vacuna, pero hay otros lugares en donde puede obtener la información y en eso estamos en estos momentos.
Do you want me to add a little bit more in Spanish as to what I just said? Would that be helpful?
Please.
Okay, entonces también en el internet para el estado del departamento de Nueva York, perdón, el departamento de salud para el estado de Nueva York, y también tenemos esta información para que uno se pueda inscribir en idiomas justo también en español. Entonces cuando uno va al internet de la página web para las vacunas, para inscribirse, ahí uno también puede hacerlo en español. Y yo con mucho gusto les puedo pasar la información también por el chat.
Right. Great, thank you. Before we move on to the next question, I want to make sure, is there anyone else who wants to add to that question about vaccines eligibility and other information they want to add?
Hi, I'm Lekeyah Wilson from Rochester, New York. I can speak for Rochester Regional Health. For our patients that are 65 and older, there are robocalls that are random in the patient's names and whatnot, that they're actually calling the individual to schedule appointments to come into the hospital to get vaccinated. If you miss that phone call, because it will have a 922 number and you can't call back to verify your appointment or make an appointment, you will be put at the bottom of the list, but they will call back again. So families, patients of Rochester Regional Health, they can be expecting phone calls from the hospital system to schedule for them.
I'd also add to what Kay just said, I am at NYU Langone Health, and for our patients there, we are scheduling appointments. So we are reaching out to those who are 65 years of age and older, as well as healthcare workers and those who are working at the College of Nursing, College of Medicine at NYU, and telling to schedule appointments. And if they don't schedule their appointments within 48 hours, then that appointment is foregone. So that's something to also be mindful of. If you do receive notification to schedule an appointment, please do so right away. And there are, outside of that, when it comes to the 65 years of age and older and healthcare workers, it's pretty easy to say, okay, you're eligible and we know who you are. But those others, and people have kind of dropped in the chat, you know, those who are essential workers, that maybe this information is not known to your clinician, or you don't have an identified primary care provider. That's why it's important that you go onto the website. So, and someone just now dropped it in the chat, and maybe not. So I think it was dropped in the chat before, but there is a website, covid19vaccine.health.ny.gov, where you can go to an app that says, am I eligible? And from there, you can fill out a vaccine form. There are some vaccine appointments available, but very limited. And it says you can wait almost 14 or more weeks to get a vaccine. Also know, if you are identified that you are an essential worker, just because you're an essential worker doesn't mean you're going to be called in right away too, for those who are being called in, because they still have to allocate vaccines to people. So for example, I'm a frontline worker and I wasn't called in right away. It still took a couple of weeks for me to get called in for my appointment.
Okay, all good information. So it's check the links, right? Know your provider and contact them, keep your appointments, and check your eligibility first and foremost. And we dropped all that information in the chat. We're going to pause again for Spanish interpretation.
Sorry about that. They talk too fast, and I need, when they talk, to pause a little bit. That way I can gather the information. But I can say a little bit of what I caught. En estos momentos están ellos haciendo citas concernientes a Rochester, Nueva York. Están haciendo la cita para hacer las pruebas de las vacunas de COVID en estos momentos, y lo están haciendo por grupo. So if they can say it slowly, a little slower, and take their time, I can get in there.
Absolutely, absolutely. Thank you. So panelists, we just, obviously you heard the request, if we could slow down, and probably myself too, to slow down and allow for the inclusion of all the participants here. Okay, so we'll move on to the next question, which we have is, now that the vaccination is underway, is there less risk of a COVID spread?
Ahora que la vacuna está de camino, se está regando más, hay menos contagio o hay más del COVID.
So did anyone, one of our doctors want to answer that question, or Ms. Alvarado-Little, are we safer now that should we let our guard down, so to speak, I guess?
I think it's too soon to tell, basically. We know that the vaccines stop symptomatic COVID and severe COVID, but we don't know if it stops asymptomatic spread. And so we're not able to let our guard down yet. We have to continue to mask, continue to social distance, continue to avoid large crowds and hand wash.
We're going to pause again.
Todo esto ha sido muy pronto. Hasta ahora están dando la vacuna para parar la sistemática del COVID, pero no se sabe si se puede para la gente que son sistemáticos, asistemáticos. Y no, en estos momentos no dejar de mantener las manos, lavarse las manos, mantener distancia social, no estar en grupos muy grandes y continuar tomando la precaución adecuada.
Okay, thank you. So if we can't relax now, when is it safe to say the pandemic is over? Like when do we know that, right, we've won the war on COVID-19? How do we know? We'll stop for the translation.
Decir que ganamos la batalla de COVID. ¿Cómo podríamos relajarnos ahora? ¿Cómo podríamos, cómo sabremos concerniente a que esta pandemia no continúe? ¿Cómo sabríamos que ya se terminó, que ganaremos la batalla de COVID?
Okay. Does anybody want to venture on that one?
Sure, I can go ahead. So when we have won the war, we'd say when we reach a herd immunity. And at that point, that's going to be about 80% of everyone in our country vaccinated. So the question is, where are we right now? Right now, we have in the United States, 6.5% of people who have received one dose. In New York, that's 7.2%. Who have received one dose. And one dose is one thing. One dose is not going to give you full efficacy that the vaccine promises or lends itself to. So the 2 doses, we only have 1.2% of our population vaccinated with 2 doses. So we need to get to 80%. So Dr. Fauci, he believes that that will be in the summertime. But at the same time, and what was mentioned before, the vaccine itself is not going to save us. It's each one of us doing our part to actually win the battle. The battle's not going to be won on its own. So people need to actually go out and get their vaccine so that we can reach those numbers. If we don't, we're not going to necessarily be out safe. And even those who have gotten their vaccine, like what was said before, they're still going to have to mask up.
Okay. Great, thank you. That very valuable. We're going to pause for the Spanish translation and then I'll follow up on that.
En estos momentos hay un 6% por persona en el estado que se han puesto la vacuna. Son 2 dosis y hasta ahora 1.2% de población se la han puesto la vacuna, pero de acuerdo al doctor Fauci creen que debe de ser un 80% que podamos ponernos las vacunas, esperando que cuando llegue el verano podamos lograr esa meta de 80%. Y eso no nos va a salvar en ponernos las vacunas, poner nuestra parte, si no, no lograríamos y no lo salvaríamos en contra del COVID. Pero si ponemos nuestra parte, lograremos en poder ganar un poco la batalla del COVID.
Thank you. Does anyone else want to add to that on herd immunity or where we are right now?
And then we also have to remember that best case scenario of getting 80% of our population vaccinated by the summertime, that does not include our children. And so we are still in trials to make sure that this vaccine is safe for individuals under the age of 16.
Excellent point. I definitely want to pause again right here for the Spanish translation on that.
En estos momentos, pues, el 80% que están hablando que quieren lograr, eso no incluye a los niños. Estamos tratando de ver cómo podremos lograr esto de niños de menos de 16 años para abajo. No incluye los niños y eso solamente es el 80% y niños.
Very good. Anyone else want to add on to that question or follow up that point? We'll move on. We have another question here. There's been a lot of hesitancy. People are hesitant in many communities about the vaccine. The biggest question is, are the vaccines safe and how do they work?
Hay muchas dudas en este momento con la gente. Queremos saber cómo funciona esta vacuna y cómo trabaja.
I think one of the first things that people wonder when they start talking about this vaccine in terms of safety is, will it work for me? Is it been tested on someone who has my skin color? And fortunately, both of the Moderna and the Pfizer vaccine trials, they did really make that, effort to try and match US demographics. So in both of those trials, 10% of the participants were Black. In the Pfizer, there was, it included Brazil if you went worldwide, and that was 26% Hispanic. Moderna had 20% Hispanic. And then there were similar percentages that correlates with the US demographics, both for Asians and Native Americans. I'll pause there.
Okay, great, thank you. And we'll pause for the translation.
Cuando hablamos sobre el sistema de COVID y sentirse a salvo, nos preguntamos, ¿trabajaría para mí? ¿Qué pasaría? ¿Se ha probado en el mismo problema que tenga yo? ¿O por el distinto de color de piel, sea de diferentes color de piel? Han hecho como un trato, lo han tratado en el 10% de personas negras, y la Pfizer lo ha tratado por la área de Brasil 26, que hay 26% de hispanos y unos 20 por áreas van por áreas demográficas y están tratando de la gente asiática y gente de color y en diversas partes del mundo.
Thank you. You have more to add, Dr. Finlan? You're on mute.
Yeah, I have to figure out the space bar thing is a new thing for me. Another concern I think a lot of people have is the speed with which this vaccine has been rolled out. I think one or two things even pop up in the chat. And it is true that no one has ever produced a vaccine this quickly. And I think there's a few reasons that are important to understand as to how this came about and it was still managed to be done safely. First of all, it wasn't starting from scratch. I believe the senator mentioned that we've had MERS and SARS around and they've looked at vaccines for those. Mm-hmm. So we've had a good 10 to 15 years of mRNA vaccine research under our belt already. Secondly, one of the things that makes vaccine development take a long time is it's an expensive process. You have to start with animals and look at safety and efficacy, and then people, and you do phase 1, phase 2, phase 3 trials, which are the big ones. Mm-hmm. And each of those gets more and more expensive as you go along. And because so much funding was poured into this venture, they were able to overlap the trials, which helped compress the timeline. But each trial still went through the same safety monitoring that they would individually. They also, as they were going along, did not encounter safety concerns, which also helped because they didn't have to pause or stop the trials. They were able to continue through. Mm-hmm. Thirdly, just as the phase 3 trials were kind of ramping up, COVID was coming back up in another wave. And you need to have people infected to see if the vaccine actually works. So that actually timed out well for them. So the timeline was compressed, but the trials were not compromised. I apologize, I can help with some of the translation if you need.
All right, all right.
Concerniente al proceso, como esto ha ido, sí es muy cierto, la gente está preocupada, es muy cierto que la han producido muy rápidamente, como esto ha sucedido tan rápido y la han puesto ya a funcionar. Como esto se ha desarrollado ha sido algo muy costoso y tiene su faceta. La tratan en animales primero, luego en personas, tiene otra faceta, faceta 1, faceta 2, faceta 3, y han podido poner tiempo en esta vacuna. Y también se han sobrepasado del tiempo, ya que esto se ha hecho anteriormente, tiene años ya. No, han puesto como safety.
Seguridad.
Gracias. Han puesto seguridad concerniente a esto y lo han tratado, lo siguen tratando y volvemos, ya que cuando llega a la faceta número 3, durante el tiempo que se ha hecho, se ha desarrollado el COVID de diversas maneras que ha demostrado hacia nosotros para poder seguir estudiándolo un poco más.
Oh, great, good. Again, before we move on to our next question, is there anyone else on the panel who wants to add to that in terms of the efficacy, the safety and how they work? And thank you, Dr. Finlan, for that great answer.
And so just some additional information, just to piggyback on what Dr. Finlan was saying, that, you know, the clinical trials did have 4 phases. The first phase involved about 20 to 100 healthy volunteers. And then, you know, just with very basic research questions, phase 2 increased the number of volunteers to several hundred. Phase 3 had over 1,000 volunteers. And that's an understatement because according to an article from the New England Journal of Medicine, phase 2 to 3 with Pfizer and biotech clinical info, they had about 43,000 participants who participated at 152 clinical sites across the globe, and 130 of those sites were here in the United States. And so half of the participants received the vaccine and the other half received a placebo, which is, you know, not medicine, I guess, that's my non-clinical jargon, right? And so the demographics, I want, whenever the interpreter wants me to stop, I will. The demographic. I would say now, huh?
Yeah, I was saying you can, if you can repeat it in Spanish, feel free to keep going.
Sure. Okay, thank you so much. Yes, entonces, yes. Para los estudios clínicos, entonces habían 4 facetas. La primera era voluntarios entre 20 a 100 voluntarios saludables. La segunda fase, varios más o menos más 100 voluntarios. Y también la faceta 3, más de 1,000,000. Y entonces la faceta 4 es cuando aprueban la vacuna. Pero con la farmacéutica Pfizer, BioNTech, según un artículo, un estudio en los estudios de New England Journal of Medicine, y eso es una publicación médica sumamente respetada y con mucho efecto y eficaz. Ellos explican que en estos estudios tenían más o menos como más de 43,000 participantes que participaron en 152 sitios clínicos a través del mundo, y 130 de estos estaban aquí en los Estados Unidos. Entonces la mitad de los participantes recibieron la vacuna y la otra mitad recibió un placebo. Y entonces los demográficos de los participantes, 49% eran mujer, 51% hombres, 83% blancos, 9% negro o afroamericano, 28% latino y 4% más o menos asiático y menos de 1% eran americanos nativos. And so what I finished saying, after half the participants received the vaccine and the other half received the placebo, the demographics of the participants were 49% female, 51% male, 83% white, 9% Black or African American, 28% Hispanic or Latino, Latina, Latinx, for a little over 4% Asian, and less than 1% was Native American, Alaska Native. So that's a lot of people.
Yeah. So what I'm hearing is that there was a lot of work done to try to make sure that the results were valid for the what I'll say the racial composition of the U.S., that they maintain the process that they would for vaccination, for creating vaccinations and any other circumstances, even though it was in a compressed timelines, that there were a lot of good things that happened here to make sure there's some integrity to the process, as well as what we would think of as the results for those vaccines. Did I get that right?
I would say so.
Okay, very good, very good. So I'm going to move on to another question, which is there anyone who shouldn't get the vaccine?
La próxima pregunta, ¿alguien no debería de obtener la vacuna?
Doctor, yes.
I guess I can address that one. Right off the bat, individuals under 16 should not get the vaccine. Those who are immunocompromised or immunosuppressed, they need to actually speak to their physician before to determine if they're eligible for the vaccine, and also those who are on chemotherapy.
Okay, and we'll again pause for that translation.
Bajo la edad de 16 años o menos de la edad de 16 años, no debería de obtener la vacuna. Primeramente, quiero comenzar con eso. Gente con que el amino comprometido o supresivo no lo puede tomar, o la persona que esté bajo quimioterapia.
Okay. And does anyone want to add to that answer?
I'll add, it kind of goes without saying, but you, if you have had a prior allergic reaction to one of the mRNA vaccines, you should not. And if you're allergic to any of their components, one that's made the news a lot is PEG, or polyethylene glycol, which is something that can be found in Miralax, is one of the pretty common things, or ultrasound gel. And then another special population that should have a discussion with their OBGYN or family doctor is pregnant and breastfeeding women.
Okay.
Personas con alergia que tengan algún tipo de reacción que le puede comprometer su salud, si tienen, utilizan algún tipo de PEG o glucolax o mirolax, que las personas que han utilizado no deberían de obtener eso. Las personas que están utilizando gel de ultrasonido, o mujeres que están embarazadas o no pueden, o están dando el pecho al bebé, no pueden obtener esa vacuna.
I just want to clarify. It's, so, la gente que está embarazada o dando de pecho sí pueden tomar la vacuna si lo quieren, pero deben hablar con su doctor o doctora sobre su riesgo propio para evaluar cuál es la mejor decisión. And si estás usando la gel ultrasonido y Miralax, no es que no puedes tomar, es que tiene alergia a uno de los ingredientes que se llama PEG o polyethylene glycol.
Gracias.
Great. So, and we'll wrap up our pre-selected questions before we go to the Q&A, and Jackie will ask those questions. Before we do that, I want to just ask everyone on the panel, is there anything you want to add about the COVID-19, the vaccine, or healthcare in general that people should know? And I'll ask that if you can repeat it in Spanish, feel free to go ahead. But also as you're responding, please allow the time for the interpretation, the translation, and pause. We're going to pause for a second so the Spanish interpreter, Ms. Elda, can translate that as well.
Si alguien tiene alguna pregunta, duda sobre el COVID, por favor, pueden mencionarlo, decirlo, hacer las preguntas. Si las tienen en español también, por favor, siéntanse en libertad en decirla. Y cuando la digan, pues si la dicen en inglés, traten de decirla un poco despacio para yo poder interpretarlo.
All right, thank you.
I just wanted to add in regards to the immunocompromised folks, in most cases, it could be likely that you're still okay to get the vaccine. It's just a thing for you to understand that the vaccine may not be as efficacious within you because of your decreased or weakened immune system. So that's something to just know. And then also other populations that should take caution is those who had severe anaphylaxis or allergic reactions to vaccines or shots in the past in general, so not just mRNA. And when you know that, to present that to whoever's giving you the vaccine, and in most cases, you probably want to be at a place that can monitor you for a good amount of at least 15 to 30 minutes after getting the vaccine, and also have the proper resources to be able to administer to you if you need a response. And then one thing I just wanted to touch on with kind of the last...
I'm going to stop this for a second just so we can get the translation in.
Ok, quiero decir que pueden obtener la vacuna, pero si tienen el sistema inmunológico muy flojo, muy débil, la pueden obtener, pero es un poquito difícil. Ahora, si toman la vacuna, si se ponen la vacuna, es mejor esperar 15 minutos y que lo atiendan y le den el recurso apropiado.
Thank you.
I just wanted to add a piece about the mRNA. There's been concerns about what is this mRNA? Is it going to change my DNA? Am I going to get an autoimmune disease, afterwards? So one thing, it does not change your DNA at all. The protein does leave your body afterwards. And one ways it has been described is mRNA is like a teacher that shows the body how to make the antibodies that fight off COVID. And something just to think in the broad scheme of things, you'd be more likely to get hit by lightning than to die from COVID after getting vaccinated.
Thank you. We'll pause for the translation.
I'm gonna give it a shot because the last part I couldn't get it very well. Si tienen el sistema, la gente se preocupa si tienen un autoinmune, le pueden causar una, how do you say disease, good Lord?
Una enfermedad.
Gracias, una enfermedad del autoinmune, o le puede cambiar el ADN. Quiero que sepan que hay una proteína que se va de su sistema. Corríjame si estoy mal. Ella dio el significado de marinade, pero lo dio muy rápido. Si alguien puede ayudarme con eso.
Dijo que hay más posibilidad que vas a morir si un relámpago le cae, comparado si vas a morir de COVID después de estar vacunada. Something like that.
Yeah. And I'm just going to open it up, panelists, if you want to respond, and then we'll jump to Jackie.
Sure. I just want to say that the community really needs to trust the resource of where that information is coming from. We encourage our community to ask their questions because the questions are important. And who do we trust as a resource, right? So, you know, do we trust our grandparent who heard this? Do we hear, you know, the neighbor who's telling us that? Somebody from the church, you know, because our communities are dealing with historical trauma in some fashion. And unfortunately, there may be those who are not having what we need at top of mind, right? The interest is different. So we encourage you, trust the leadership. For example, the senator and assembly member who spoke, you know, they are coming on here to talk about, you know, the experience and to support the community. And so please think about, if something says, you know, well, I heard this, that, or the other, where did you hear that? You know, so please ask the questions. The questions are important because that's how research can move forward and how we can keep New Yorkers safe. So trust the resource and ask your questions, all right? And I'll say that very briefly in Spanish. Entonces, mis 2 centavos aquí es que ténganle confianza en dónde están recibiendo su información. Y también hagan sus preguntas, porque las preguntas son sumamente importantes. Entonces, por ejemplo, de la fuente de información sobre la vacuna, porque uno tiene confianza a la abuela, la vecina, alguien de la iglesia, pero necesitamos saber que estos también sean fuentes de información seguros, porque podemos decir, es que mi abuela me dijo, la vecina oyó que esta de la iglesia me ha dicho tal cosa. Entonces necesitamos tener las preguntas, porque de las preguntas nosotros aprendemos y eso ayuda a las investigaciones, ¿no? Los estudios. Entonces eso es sumamente importante. Aquí hemos tenido la senadora, la persona de la asamblea, personas que sí tenemos confianza, que apoyan la comunidad y tienen nuestro interés así como cosa principal. Y desafortunadamente hay unos allá en el público que no están en esa misma página, ¿no? Entonces hagan sus preguntas. Pregunten cuando alguien le diga tal cosa, por favor, porque eso es sumamente importante. Sus preguntas son sumamente importantes. Gracias.
Great, thank you. Okay, we're going to turn it back to you now, Jackie, for some questions from the Q&A in the chat. Thank you, panelists. And I want to just thank everyone for hanging in there with us. It's an important topic. We're running over time, but I hope you agree that it's well worth it. Thank you for sticking with us. Now we'll turn it over to Jackie and see what we have in there for questions.
Yes, thank you, Yomika. Thank you so much to our panelists. I've been toggling the questions. We're getting a bunch in the chat function. The first one that I'm going to toss to whomever would like to answer is, if you have antibodies in your blood, do you still need a vaccine?
Si tiene en su cuerpo anticuerpo sangre. Can you repeat that question again? I'm sorry.
Sure. If you have antibodies in your blood, do you still need a vaccine?
Tiene en su cuerpo sangre o en su anticuerpo sangre, ¿todavía requiere la vacuna?
Yes.
Sometimes it's as simple as that, right? Any of the other panelists want to expound on that?
At this time, we're uncertain how long those natural antibodies from a COVID infection last. Could it be 2 months? Could it be 4 months? Could it be 6 months? We don't know at this time.
I'll allow for a translation on that.
El COVID puede estar you said that the COVID can be in the system for 4 to 6 months?
No, the antibodies from the COVID infection.
Después de obtener el COVID, el anticuerpo puede estar ahí en su sistema de 4 a 6 meses.
Thank you for that. So we have quite a few students on the call. They're dropping their schools in the chat. A few asked rather about access for students, what that looks like currently, and if there's any information on access in the future.
I mean, I know the Moderna trial, Moderna is currently recruiting for 12 and up for their trials. I don't think we have a timeline yet. Somebody correct me if I'm wrong. I haven't heard of anything as to when we know those trials will be done and that the vaccine will be available. Now, Pfizer did do its trial on 16 and up. So if you fall into a category where you would be, for example, if you work at the grocery store, I believe now you are eligible, but you'd have to get the Pfizer if you're 16 or 17.
I'll allow for translation.
Los jóvenes pueden, bueno, hay un tratamiento como de varios días para hacer esto. Pfizer ha salido con un tipo de tratamiento de varios días, pero hasta ahora, Lina, if you can help me out.
No problem. So ahorita Moderna está recruiting, is not a word I know.
Está eligiendo.
Eligiendo los edades 12 y más arriba para sus pruebas. No sabemos cuándo van a tener resultados o esas vacunas van a estar disponibles para la gente. Pero si Pfizer hizo su prueba en los gente de edad 16 y arriba, entonces si usted es elegible para una vacuna en este momento, por ejemplo, si trabajas en el supermercado y puedes tomarlo, pero tiene que ser el Pfizer.
Thank you for that. So that concludes the Q&A portion. There's a lot of questions in the chat. And like we said, we will be linking all of the resources that have been referenced to our resource hub. And if a Keller test can throw that into the chat, that would be great. And I'll allow for translation on that as well.
Hasta ahora se ha terminado las preguntas. Vamos a poner toda esta información y estos recursos en la área del hub y vamos a tener a alguien que va a poner el enlace en la caja de chat.
Thank you. So thank you so much, everyone, for being here tonight, for your patience as we navigate this issue, this important issue. And so we thank you for your service. And we are also going to be continuing these conversations. As many of you mentioned, this is something that we have to, these are conversations that we will have to continue to have with people within our circles and beyond.
Thank you.
Absolutely. We hope everyone found this forum helpful and to make an informed decision about the vaccine. We also ask all charter school parents to sign up for the New York Charter Parent Council, put that a plug in there. And I cannot thank the panelists enough. Thank you for your time this evening. Thank you for your expertise. Thank you for your translation. Ms. Elda, thank you for your translation. Dr. Finlan, Dr. Travers, Ms. Alvarado-Little, Dr. Wilson, again, from the bottom of our hearts, obviously, thank you for this. It's tremendously important information.
Yomika, we have Nancy on the call too. I wanted to just talk, we referenced earlier, and Nancy, you could translate this if you don't mind, but we referenced earlier when Assemblymember Walker was talking about testing in order to help stop the spread is also equally important. And so tonight we have Nancy Pascal, who is a friend and a leader in Brooklyn and beyond, here from New York City Health and Hospitals Test and Trace program, who's going to talk for a minute about how you can access testing in the city of New York.
So I will quickly put it in the chat. This was an amazing conversation. This kind of conversation should be happening every day, all the time. I just want to say that as we think about the vaccine, as we prepare for it, as we think about it, that we don't forget that testing saves lives. That when you see these hotspots, we have learned through experience that when people get tested, and the more people get tested, people will quarantine. And so you're not walking around for 3 days passing out, you know, coronavirus to other people because you don't know you have it. You know, you're maybe 2 days or not 6 days out there. So people react to COVID in many different ways. Sometimes people don't realize it right away. So the key, the switch was in the beginning, we didn't have enough, right? Then we got enough, and then we realized that this stops the spread. So that is, do your part and get tested as often as you can. Thank you so much. I'm not going to take any more time. Oh, I want to tell you that the city has resources. You can quarantine, and that number is 212-268-4319. That's 212-268-4319. And that resources, that number, you can get food delivery. They will include paid leave from your employer, medicine, health insurance, help you with a formal quarantine order, help you with a primary care provider, mental health support. So the resources are out there, and you know, it may take a long time for someone to answer the phone, but trust us, get on the phone, get tested, and protect yourselves. Thank you so much for your time. I appreciate it.
Thank you, Nancy. Did you want to say any of that in Spanish? Maybe some of the resources?
Oh, yes, absolutely, absolutely. Nosotros vimos que cogiendo la prueba de COVID-19, eso salva la vida, la comunidad. Cuando nosotros en el principio no teníamos mucho del pruebo. So dijimos, mira, si te sientes enfermo, eso es cuando te debe probar. Ahora, fijemos que ahora que tenemos mucha prueba, cuando hay áreas que hay mucha gente que están cogiendo COVID, vimos que cuando la gente tome la prueba, ellos no se acercan más a la gente. Y eso pasando la enfermedad. So, estamos hablando de la inmunización. Estamos hablando de eso, pero no te olvides que también ponte la máscara. Si vas a visitar a alguien, ponte la máscara, lava la mano. Eso la misma cosa, pero también haga la prueba, porque eso también está ayudando a la comunidad. Muchas gracias. Y hay toda la información que yo di de comida, puedes ir para un hotel. ¿Cómo se dice hotel en español? Se me olvidó.
Hotel.
Alguien. Dilo. Un hotel. Comida, información, 212-268-4319. 212-268-4319. Y poncha 5 para ayuda. Press 5 for help. Press 5 for help. And so it may take a minute, but there is support out there. You are not alone. Hay ayuda afuera y no importa, no necesita ID. You can be undocumented. No importa, okay? Y nunca tienes que pagar para la prueba. Nunca. No tienes que cambiar nada. Cada hospital público, tú puedes coger la prueba gratis. No tienes que pagar por la prueba. Okay.
Thank
you.
You
never
Nancy.
have to pay for the COVID test.
Thank you, Nancy. That was great. That was a lot of information. Very helpful. We'll put that on the hub. Oh, go ahead, Nancy.
Next month, our focus, by the way, there has been an increase in the spread between 13 and 17-year-olds. There's been a spike. And so we want to approach, because this spike, we don't want to approach it as you guys have been doing bad things and that's why you're spiking. A lot of these children are getting COVID, no fault of their own. And so we're asking if there are any events out there, if there's any outreach that where we should be. If you want any information from us, please contact me. We wanna do any event or virtual where we can remind young adults how important it is to stay safe and get tested.
Jackie,
and have
you
your
taking
family
what I'm
get tested.
thinking?
Yeah, I know, right? We got to do a part 2 of
That's
this
right. Yeah.
Because this conversation has to continue. And I love what you said, Nancy, about stopping the spread. It's super important to continue to also take safety precautions, such as wearing your mask, staying socially distant and the like. So thank you, Nancy, for that. And just as a plug to all my AF parents and family members and students on the call, on February 10th, we are going to be having our first New York Parent Council meeting. You can sign up for that, and the link is in the chat. So that's the 10th of February for our first Achievement First Advocacy Parent meeting. We will be talking about ways to stop the spread, what we can do, and also how we can advocate. We heard from some of our elected officials today, but how we can advocate on the city and state level around issues regarding equity and access within our schools and within our communities. So sign up for that. And then for everyone, for the general public, for everyone on the call, because we have schools from all over the state of New York and people from all over the state, we are going to be having on February 24th an event around ranked choice voting. So the city in New York City, we're approaching our mayoral and some important city council races, as well as some other seats, including comptroller. And so there is a new system in place around ranked choice voting. So we will be having an event on February 24th, and both of those links are in the chat. Registration is open. Feel free to RSVP for those events. Thank you so much to everyone here. Nancy, you are popular in that. You want to you want to drop your info in there. You are popular as usual. Thank you, Nancy. Thank you to all of our esteemed guests. I'm going to turn it over to Yomika for some final words.
All right. Thank you, everyone. I've said thank you. I want to say that again. Can't stress it enough. You hear the shout out for follow-up events. So stay tuned for for us to reach out to you if you ever have time and are inclined again to come back. Continue to share your advice with folks and your expertise and good information. Again, we so appreciate it. It's so incredibly valuable. Thank you, thank you, thank you. Thank you, everyone, for sticking with us. Stay safe and have a good night.
Stay safe, everybody.
Good night. Stay safe. Can't wait to see you again.
Yeah. Thank you. Thanks.
Bye, Nancy.
That was great. Oh, I'm not on mute.
All right. Good.